we've looked at predictors for expert pathology diagnosis in Barrett's pathology. There's a massive hiatus within the Barrett's guidelines, in that the guidelines will say that biopsies with dysplasia need to be reviewed by an expert pathologist, but don't define what makes an expert pathologist. Now, we wanted to advance the field by, for the first time, creating objective and quantitative standards for what makes a Barrett's pathologist. And the way that we've done this is first create a data set of biopsies. We then sent those biopsies around the world to 50 pathologists, 55 pathologists in the US, in Europe, Japan, some in Australia, even South America. So really around the whole globe. And they assessed those 55 biopsies before P53 and after P53. We looked at their consensus values, and very importantly, before they started their case set, we asked them a complete demographic questionnaire so that we had information on their practice context, what their case volume is that they regularly see, whether they have fellowship training, and what their years of experience are. So that once we had the final data set, which is massive because we have 6,000 case diagnoses within our data set, we could then regress those demographic variables back onto our consensus data to, for the first time, provide us in the multivariate analysis with clear predictors of what the profile of a pathologist looks like that will score on a par with where the experts are. And that analysis revealed that you need at least 5 years of experience. On top of that, if you are a pathologist working in a district general hospital, you are at a slightly higher risk of making major diagnostic errors. But if you use P53 in addition to the H&E, then that risk is neutralized. And we can quantify all of that within the context of this large study, because that's really the power that data volume gives us. One of the reassuring points of our study was that we found that the best concordance was for non-dysplastic Barrett's and high-grade dysplasia, which really replicates known glass slide characteristics, so that we can also say that digital pathology is safe for this application, which is very relevant for pathologists that are taking in cases from outside for expert review. What I feel is important that we take these data forward, and that for the next iteration of the guidelines, we can now for the first time say that rather than have the slides be reviewed by an expert pathologist, we can give a quantitative assessment of what that means. So you have to have at least 5 years of experience, and if you work in a district general, to use a P53, and that is what collectively amounts to expertise in Barrett's pathology. The follow-up study that we're planning to this is to repeat the study within the UK, the Netherlands and the US, and to involve hundreds of pathologists, the same study setup, but to have an intervention arm in this as well, whereby part of the pathologists will undergo a short tutorial whereby they are shown different types of dysplasia, superficially spreading dysplasia, the types of lesions that we commonly see that are referred to us in our referral practice, and to then compare the group that has undergone the intervention versus those that have not, to try and see if that improves their concordance scoring.